Government health insurance coverage for every Filipino as President Rodrigo Duterte signs the universal healthcare law. The measure covers free medical checkups and medication for illnesses like diabetes and hypertension. It also gives access to some outpatient cancer treatments and dialysis packages. Here's the president in his own words.
By automatically extolling our citizens into the National Health Insurance Program and expanding PhilHealth coverage to include free medical consultations and laboratory tests. The universal health care law that I signed today will guarantee equitable access to quality and affordable health care services for all Filipinos.
Officials hope the universal health care law will encourage the poor, especially those living in far-flung areas, to have themselves checked in health centers to prevent illness from getting worse or even catastrophic. And we now talk to Health Secretary Francisco Duque III. Good morning, sir. Thank you for taking our call.
Yes, good morning, and thank you for inviting me to this interview.
Sir, many have been waiting for the universal health care law to be passed into a law, and we understand that the bill aims to expand the coverage of PhilHealth to all Filipinos, both here and abroad. So can you tell us more? How is this going to affect Filipinos? How would it change their lives?
Well, first and foremost, right now, the PhilHealth coverage has already reached about 94-95% of the population. So that also includes our OFWs and all Filipino senior citizens, the indigent families. They're all now included. And the challenge under the UHC is really expanding the benefit packages, especially for the provision of primary care packages by the lower level facilities that are closest to the communities, because that's the Achilles heel, that's the weakness in the Philippine healthcare system, is that our poor Filipinos have hardly access to the primary care services that is supposed to be provided by both the local and the national governments.
What will that look like on the ground, sir? If you know, even those the poorest families, the ones living in most far-flung areas, will get more access?
Well, because that's the challenge today. There is a very limited access to primary care facilities or lower level facilities that will provide, you know, the most basic services, such as those constituting health promotion and disease prevention, like immunization, as an example, and also maternal and neonatal child health and nutrition services, like the adolescent health care, geriatric health care, the smoking cessation programs, and also we have the, again, very importantly, especially at this time with measles outbreaks, is really expanding the immunization activities of the DOH and the local government units.
Right.
And then, of course, you have your other services constituting primary care. This is usually a population-based health services that are expected to be delivered down to the grassroots level. Because the problem right now is that most patients in the far-flung areas tend to just go to the hospital straight without being screened or without being given care for their ordinary illnesses, no, or health conditions. So you have a problem now of congestion in the hospitals, and under the UHC, this will be avoided because you will now have the capacity to provide primary care or basic health care services at the grassroots level through the health stations, the rural health units, the city health centers, and the district hospitals.
Secretary, when does the law actually take effect?
Well, after 180 days or 6 months within which the implementing rules and regulations will have to be formulated. And so we will be starting the process. We have actually begun the process of doing the implementing rules and regulations.
Now, something like this, an undertaking like this is obviously going to require a lot of money. Tell us about the funding. Are there enough funds as of now to implement the UHC?
Well, it seems the funding is adequate, at least for the first year of the implementation of the UHC. We have computed the funding requirement at 257 billion pesos. And initially, we thought there was going to be a funding gap of about 40 billion, and for which reason we were pushing very strongly for the immediate passage of the increase in excise tax on tobacco and alcohol. But according to Congress, the funding gap will no longer be there because they've identified additional sources. So this is something that remains to be clarified at this point. So we leave it to Congress in their pronouncements that there will be no funding gap in the first year of implementation. However, let me just emphasize that the move to increase excise tax on seen products, tobacco and alcohol, is really predominantly a health measure more than a revenue measure. And that is why it is very important that Congress passes the bill, approves the bill right away, and get it enacted into law. Because if you increase in taxes, you will avert 780,000 deaths in the next 4 years. You will have 3.8 million cigarette quitters in the next 4 years. And you will prevent uptake of the vice by the youth, which is a vulnerable population, to taking up this very bad, deadly habit of
That's
smoking.
Right. All right. Thank you so much for your time, Health Secretary Francisco Duque III. Maraming salamat.